So Park Central's been about 2 years in the making now. It's taken us a long time because we put in a lot of thought into making sure that we provided the right services for this community. The downtown Phoenix market is actually going through a revitalization, a lot of investment, a lot of healthcare institutions are moving here. We have Creighton University right next door. That's the biggest medical school in the state, which is awesome. We are so happy to be a part of that and be in that community. We also wanted to make sure that we hit the right service lines for our partner, Dignity Health, who has a hospital down in Phoenix called St. Joseph's. They have many specialty service lines here. They have obviously Barrow Neurological Institute, which is a world-renowned neuro program for neurosurgery as well as neurology. We also have Norton Thoracic Institute for lung transplant, lung cancer screening, and their newly forming Heart and Vascular Institute. So all that time was to make sure that we had the right equipment, the right radiologists, the right technologists, that we could launch this appropriately. And what we're doing is making sure that we complement the community. So today, they don't have a PET MRI. So we made sure we put in the PET MRI from the outpatient facility. That's gonna help people with oncological issues. That's gonna help people with neurological issues that they can't get service today in an outpatient environment. We also wanted to make sure that the entire facility provided all the services in one clinic to make people feel comfortable, to make people at ease, that they didn't have to go to 5 facilities to be seen or have a procedure. They could just simply go to Park Central. We're gonna have SPECT CT, which is a staple of advanced imaging for endocrinologists, for neurologists, for spine surgeons, for orthopedic surgeons. We're gonna have the most advanced PET CT that's gonna reduce dose, reduce scan time, reduce the amount of FDG we have to inject into a person's body. A lot of things we did here were carefully crafted to make sure that we complemented the community on what was missing and what needed to be enhanced. It's a 30,000 square foot facility. We'll have 2 different lobbies, one lobby for advanced imaging or what we would consider non-women's imaging. Women still can obviously be seen there because we're gonna do nuclear medicine, we're gonna do PET CTs, we're gonna do MRs, but we have a dedicated space just for women's health and most importantly, breast imaging that will have an on-site surgeon, an on-site breast radiologist, an on-site breast navigator that will make sure they get the care they need and that nobody slips through the cracks when they need a follow-up exam or procedure, that someone's there to guide them through that. Someone's there to make sure the referring provider gets that information and knows what to do next. We want to make this facility the easiest to use and the most convenient for patients, so that way they feel they got the best care possible all in one clinic.